My name is Lauren Stanley, and today I'm going to be showing you guys how to do an intradermal injection. So before we begin and I enter the medication room, I'm just going to go ahead and check the MAR, make sure that it's the right patient, the right drug, the right dose, the right route, and the right time. After I've checked that, I'm going to go ahead and go into the medication room. I know I'm going to be needing purified protein derivative, and I'm going to be doing 0.1 milliliters. So this is my medication, and this is my syringe I'm going to be using. It is a 1.0 milliliter syringe with a 27 gauge and a 1/2 inch needle. So after I've checked that, I'm still in the medication room. I'm going to go ahead and open it up. I'm going to perform hand hygiene. I'm going to put my gloves on. So now I'm going to go ahead and get an alcohol wipe. And I'm going to wipe the top of the vial. And while that's drying, I'm going to go ahead and open up my syringe, uncap it. I know I'm going to be needing 1.0 milliliters, so I'm going to go ahead and pull out 1.0 milliliters of air. I'm going to inject it into the vial and push the air in. Now I'm going to pull this up and pull out 0.1 milliliters. I'm going to go ahead and get the bubbles out and hold it at a level and make sure that's the correct amount. So you can see that's right. Now I'm going to scoop the cap and I'm going to go ahead and go to the patient's room. So now I'm at the patient's room. I'm going to take these gloves off and discard. I'm going to go ahead and check the MAR once again to make sure that it's the 5 rights. After I've checked that and verified that the 5 rights are correct, I'm going to go ahead and perform hand hygiene again and put on a new pair of gloves. So after that, I'm just going to go ahead and assess the skin and make sure that there's no edema, breaks in the skin, or ecchymosis, anything like that. After that's done, I'm going to go ahead and get an alcohol wipe. And I'm just going to cleanse the skin and the area I'm going to be injecting, starting from the innermost part and getting wider. After that's clean, I'm going to go ahead and check the medication one more time just to make sure that it is correct. And after verifying that it's right, I'm going to go ahead and uncap the needle. Making sure that my bevel is pointed up, I'm going to go ahead and hold the skin taut and inject the needle at a 5 to 15 degree angle. I'm going to go ahead and inject the medication and pull the syringe out. I'm going to go ahead and cap the needle again using the scoop method, but if this were a real clinical setting, I would put the safety cap on, but since we're not in a clinical setting, I'm just going to use the scoop method and cap it. And I'm going to dispose of this in the sharps container. Next, I'm going to go ahead and assess the skin. If there's any bleeding, I'm going to go ahead and dab it with a cotton ball. If there's excessive bleeding, I'm going to hold the cotton ball over and bandage the skin. But since there is no bleeding, I'm just going to go ahead and assess, make sure that there's no adverse reactions. And since there's not, that's going to be all that there is for the intradermal medication injections.